Okay, folks, why don't we get started? It's about 12:03, and I want to be mindful of everyone's time. So we'll get started. We have a great topic today, and I know this will be a very engaging conversation. So I'm looking forward to that. For those of you that are with us for the first time, welcome. For those of you that have joined us several times before, welcome back. This is the Vanguard Employer Education Series, which we host on a bi-weekly basis. And if you've been with us before, you know we try to fill this time with very timely, topical information surrounding the world of employee benefits and provide with really relevant speakers. And I think you will see today, I know you will see today, that we've succeeded in that regard today. So I'm really excited for our topic today. Couple of things that of note. Obviously, we are approaching on the Medicare open enrollment season, and we've been receiving many questions on that. So be aware that we are just about to enter into the Medicare open enrollment season, and we do have, and I want to be set as a reminder that United Healthcare and many of the carriers we expect to follow suit have now changed their coordination requirements when it comes to Medicare Part B. So if you are working or employ less than 20 employees and you have seniors 65 and older that are on your medical insurance plan, your group medical insurance plan, be mindful that United Healthcare has, as of July 1st, started to coordinate those benefits as if the employees did have Part B. So if you have employees that are 65 and older on your group coverage and they do not have Medicare Part B, they're going to need to do that. They're going to have a gap in coverage. So be mindful of that. Also, the Medicare Part D notices are due tomorrow, October 15th. So if that has not been done, make sure that you are sending out your notices to your employees that are 65 and older about the credibility of your prescription coverage. And if you have any questions on that, feel free to mention us, to reach out to us. I want to make mention of our next Employer Education Series event, which will occur on October 28th. Another great topic. We will have Robert Belvedere from International Benefit Administrators, who will be joining us that day to discuss self-insurance or self-funding, and it'll be a self-funding 101. So it'll be a very basic event on what self-funding is and who is best suited for it and the impact it can make. So be aware of that. That will be on October 28th. And as usual, some housekeeping items. We will be recording this meeting. We are recording it right now. And Pat has generously shared the deck with us. So we will be sending that out as well after the event. So you will have that recording and the event slides afterwards. So be aware of that. And along the way, we want to try and keep this as engaging as possible. So typically, we ask that you type your questions in the chat box, and then we will get to them. However, we're going to leave, as long as we don't have any loud feedback, I'm going to leave all the mics open. So if you have questions along the way, you can feel free to jump in, and we'll stop along the way. As I say that, I hear feedback.
Sorry, Ed.
I'll monitor that. It's okay. I'll monitor that along the way. But if you have questions, be sure to jump in, and we'll get to them along the way. And with that, I want to introduce our speaker today. So we were fortunate enough through our relationship with Northwell Health to have our speaker agree to join us today. Our speaker today is Patricia Flynn, and she is the AVP of Employee Wellness at Northwell. So she's a leader in influencing programs and initiatives that help organizations create cost-effective culture of health. Pat Flynn is currently the Assistant Vice President for Employee Wellness at Northwell Health. Prior to Northwell, she worked for 25 years at Johnson & Johnson, beginning as an administrator for the Live for Life Employee Wellness Program and advancing throughout the worksite health and wellness industry, including Director of Strategic Accounts for Johnson & Johnson's Wellness and Prevention business, where she led the culture of health assessment process with employer customers. At Northwell Health, Pat and her team are committed to creating a culture of well-being amongst the workforce aimed at improving health outcomes and employee engagement. Believing that caring for our patients begins with caring for people drives the vision of being the healthiest place to work by 2022. Pat and her team have enrolled over 48,000 employees on wellness platform, transform the food and nutrition for both employees and patients, and continue to bring impactful health and wellness programs to Northwell Health. Pat holds a bachelor's in psychology and a mini MBA from Rutgers University and has completed Harvard Business School's advanced management program. Pat is passionate about service, volunteering as an EMT for her local first aid squad and her church outreach programs. Pat and her husband have 3 sons and live in Somerset, New Jersey. So welcome, Pat. That's quite the resume. And I think, we have accomplished what we set forth, which was to get somebody who really knows what they're doing in the field of health and wellness. So thank you for that. I'm going to turn it over to you and let you introduce yourself and get started with our presentation. As I said, let's make this really interactive and fun today, guys.
Very good. Thank you so much, Ed. And it is really my privilege to be here today. And I do really want to make it conversational. And also, don't worry about wherever you are in your journey of wellness with your organization. Some of what I'll talk about is for any size organization. Don't get nervous about the 70,000 that we have at Northwell, which has really just been a wonderful place to work. And I have a few of my team members are on the call. So Lauren and Dina are on. So everybody just jump in when you can. So next slide, Dina. So, again, it's been my privilege to be here, but it's my privilege to work in this field so many years and to see what wellness and well-being really can do. But now more than ever, it's incredible. Wellness has been in the spotlight. I'm sure you've seen that in the media. If we can help our employees through this pandemic, our employees who have any comorbidities, who are diabetic, who are hypertensive, they need us more than ever because they're more at risk during this pandemic. Next slide, Dina. And the culture that you create, a strong culture, and Ed talked about before we even got on about having a culture where people can really just be themselves and bring themselves to work. It really will enable us not only to survive during this time, but to really help our employees thrive. Next slide, Dina. So I really want, one of the things that's been I've been promoting for years is this has to be more than a program. It's not just, bring in a weight control program or bring in a little topic here and there, but really what is the culture that you're creating for your workers, whether it be 5 employees or 70,000 employees. It's the way employees are treated. That's well-being, that's wellness. Next slide. So a few things about the culture. Ed said in my bio that one of the things I did for years at Johnson & Johnson was assess cultures. Like, what are the things that are in place that make for a healthy culture, a culture of health and well-being? And none of these will be a surprise to you. So leadership, what kind of leadership are you showing for your employees? It's so important. Can you walk the walk? Are you transparent? And more than ever now during this pandemic, employees want a trusted resource. They look to their employees for good information. They want to know, what's going on in terms of when should they come back to work? Is it safe to be in their workplace? So transparency, very important. The environment, are there opportunities? Is there like some healthy food maybe? Is it okay to take a break for a minute, for 90 seconds, for every hour or so? What's the environment that you're creating? How are you communicating things? This is so critical. I mean, you can only imagine for us with 24 hospitals, how do we communicate with employees? How do we get the word out? For us, we do and Lauren's on the call, we do a network of sort of champions, or we call them liaisons, where they just get the word out for us on any activities or things that we're trying to get out there. evaluation and metrics, are your outcomes measured? This actually makes me happy. During one thing I've noticed now during the pandemic, the focus has gotten a little bit off of, is it, how are we measuring wellness programs? Yes, it's important, but more important, are we engaging employees? Are they feeling cared for? That's what we're looking for. It's a little bit harder to measure, but that's so important right now. And then you can only imagine diversity inclusion during these times. How are we fostering respect for employees? The number one thing employees say is, I just want to feel respected. I want to feel cared for by my employer. So these are some of the elements of any healthy culture. And think about a place that you've worked where you feel like it's been a positive culture. I'd love to hear from you, when we, at the end of this, what did that culture feel like? And it would be healthy if you're talking about a positive culture. Respect, communicated to, very transparent, and some opportunities to be healthy. That's a healthy culture. Next slide, Dina. Mhm. And so you see this pretty flowered print. There's lots of different models like this, and we use one of them. But really what it is, again, what I've seen over the years, we've really tried to redefine wellness to be much more than just the old, get a test here or there, or eat healthy. This is a really expanded version of well-being that we use at Northwell. And it's really around improving the health and well-being of our team members. And then we're trying to take what we learn and apply it to the communities. So I'm so happy to be here with you today. It's the physical, it's the emotional, it's the social. And what do you think? One of the most important ones, of course, during this pandemic has been the financial. I mean, that's what we're hearing from our employees. Social. If you have remote workers, how do you make them feel connected? That's very important during these times. The emotional and mental, I'm happy to report that I feel like we've moved the needle a little during this pandemic on, removing the stigma around emotional and mental well-being. That's been very important. And I'll tell you a little bit more about that in a little bit. Next slide. So this slide, don't get nervous when you see this. This was just a sample to show you, this is how we approach, and I have a little worksheet for you later. If you can do one thing in each of these categories for your well-being, for your employees, no matter how many you have, that will be fantastic. I just put that out there so that you see it's not just exercise. In the old days, people thought, oh, I have to have a gym. No, it's not that. If you have some way to help employees with their physical well-being, great. Some walking tips about walking, some type of assistant. There's so many free resources out there, and I would be happy to let you know about those when we're done. Food and nutrition, you can imagine, became very important during these times, the last 6 months. Think about it. People are at home with their families. They're not going anywhere. And it's been a fun thing to do, to maybe cook with your kids, to think about more healthy eating. So this was a really important one. So we'll get into that a little bit more. Next slide. And so in the agenda for today, we talked about what would be some best practices. And these really are attributes. Over and over again, these are the things that are so important to employees, whether they're working remotely or on site. Employees want to know that whatever you're telling them comes from a trusted resource. So if you're going to put out any kind of health information, we got to make sure that it's, Heart Association, CDC, Cancer Society, Northwell Health, we hope. So that's an important one. And we've heard that over and over again from people. That it is holistic, as I just told you. And again, during the pandemic, emotional, the food and nutrition, so important. The social connection. Are they accessible to all, including the families? Never has the family been more important. I've seen that throughout my whole career. but now more than ever, always, employees will not want to do something for themselves, even though we push self-care. But if you say, I'm putting this out for the families, for parenting, any topic about the families, so critical during this time. Technology has never been more important, and I'm fingers crossed that we make it through this whole thing with no problems. But it's important for employees that are working remotely, of course, that they have reliable technology. Privacy. I can't emphasize this enough. So whatever you're doing with your workers, to just say this is private, and if you do some type of an enrollment for them on a wellness program, that it is private. Communicated, of course, it's so critical. So many things that we offer, but people will say, I never knew we did such and such. But how do you communicate? And then, of course, free, no charge. We try to do a lot everything that we do, and if anything you can do free, that's of course really important. The old days, people would do, they would actually charge for different wellness programs for the employees, take it out of paychecks. I guess that's, that worked at the time. There was studies around motivation for that, but now, we're looking at no charge. So these are just a few of the attributes of any good wellness program.
So Pat, just if we can jump in with a question there, I think that's a great segue into something that I was thinking. From an employer's perspective, I agree, and we've seen that in the past where employers used to charge for wellness programs. And I think from what we've seen over the years is that employers were really confused about the value that wellness programs brought to their organization, how they could create ROI on that. And a lot of it, in our world, we see that we get questions about health insurance benefits, right? And, the impact of wellness on health insurance benefits is certainly not something that's easily measured.
Right.
But employers do ask those questions because it's probably their second biggest expense that they have. And so that we've seen in the past that they were very trained to, how do I get ROI on this? And we are seeing from our perspective and you use the word culture, which is something that we talk about all the time, right? Culture, becoming an employer of choice. And
Yeah.
we're seeing that there is somewhat of a shift in even smaller organizations toward that type of culture. But if you could speak to just how that's transcended somewhat over the years, what you're seeing, and we know that in order to get wellness programs to be productive, we need to get employees to engage, and in order to do so, the leaders have to really be engaged in that. So if maybe you can just speak a little bit about what you're seeing and that shift over the years.
Well, Ed, hallelujah. That's all I can say, because we could do a whole hour of one of your sessions on just that, measuring wellness programs. And so much has changed. We used to be in so much pain trying to show ROI, where it's very difficult to show because it's not just one thing. There's so many integrated factors. I have noticed over the last few years, and especially now, that employers are getting it. Your C-suites are getting it, that it is the participation, the engagement that is so critical and so hard to get. So if wellness and well-being can be the thing, and we are so lucky at Northwell that we have leadership that gets that and believes that. So I do have a slide, I wish I would have included it, that shows this arrow of how, and I'll send it, Ed, how you can show value for wellness through first participation and trust. The trust is really critical in there, because employees, if they trust you, they'll engage. And so that continuum, of course you want to show some health measure improvement. Like we know at Northwell that we have high hypertension. We know that through our claims. So if we can show that we've reduced that in some groups, we'll try to do a night group or a union group, different groups. That's important. We're not ignoring that. One thing we're trying to show now is, does the healthy food in the cafeterias lead to some health improvement and therefore some cost? But we're off that train, thankfully, right now. So yeah, I'll send you a good slide about that. And that's that's really important for, especially a small employer, because the engagement and participation is just so critical.
And if I could jump in to add
Yeah.
to what Pat has said, so I think one of there's sort of these engagement, sort of soft touch blend of services and programs that we provide. But then there are some sort of evidence-based programs, for instance, diabetes management programs, where those may be more concrete in terms of progression and outcomes that we can show measurable change for people. And those are the programs that we blend in with some of the softer touch programs, like maybe yoga engagements or, workshops like meditation. So things like that, they kind of all merge together, as Pat has said. And so we move from the language of ROI to more around VOI, value on investment, and how do we sort of look at the big picture of wellness in terms of specific offerings that can create outcomes versus those that blended together create a really robust engagement culture.
Mhm.
So one other question I have around that, would you have a recommendation for an employer that it looks at all these different types of wellness initiatives that could be made? And sometimes that could be overwhelming, right? Because if an employer, like, how am I gonna engage all this, infuse all this into the culture of our organization? If there was one area that you think that they should start with, is there one that you would recommend that would be the most impactful for their employees?
I think it would be listening. So I think doing a very, very simple, and Lauren, who's on the phone, is the master, a simple monkey survey, asking people what they're interested in, because there's so much you could do. And that's why I'm going to show you that little worksheet of the dimensions of wellness, to pick just one or two. If you pick one or two based on what they are saying, I think that, and you'll see, we did some surveys, and that's what I would do. And if all else failed, you can never go wrong with nutrition, because people are interested and they'll do it, or just hypertension if you wanted to take a health measure. So, but listening to employees, and it's very, very simple to do. Okay, next slide. Yeah. So yeah, I just put this in here because Ed's going to send out the slides. You can do a little worksheet for yourself. But I would pick, that was a great segue, Ed. I would pick one or two of these and just say, like, what can I offer in these different categories to make a difference? And then first listen to the employees, and then maybe put one or two. And there's so many free resources. You want to promote some type of emotional well-being hotline that's out there. They're out there in the public domain. That's a no-brainer. I would do that one. You might do some kind of walk, but I think if you have a lot of remote employees, maybe some kind of social one too. So next slide. So this one I threw in here because I think so many of you are working remotely, and this is based on what we also heard from employees, how to work healthy while you're working remotely. And the first one is really a big one. People said that their day just blurs from 6 o'clock in the morning till 10 at night. And I know some of you on the phone probably have that. So that's important, to set a boundary, to make maybe some kind of work hours, and to control the meetings. The meetings are out of hand right now. I mean, there's a lot of meetings. So maybe a way to cut the meetings to 30 minutes instead of an hour. Things, make sure you have an agenda, things like that. Connections, checking in with each other. Asking the question, how are you, is such a simple thing, but it's so important, even if you have to formalize it a little bit. But checking in with one another. Providing clarity on roles during these times, I think, is really important. People want to know, do I have to go on camera? That's a big one. We do these meetings all day long, and some leaders who have called a meeting, they expect you to be on the camera, and some maybe it's not a big deal. So make sure you're clear on that. That's an important one while working remotely. The tools I said before, we have, and I can also send this, Ed, we have a nice little guide on what's the ergonomic setup that you can have at your home office in terms of your health and your, getting up every hour, all the different things around ergonomically correct working at home. Yeah, and then the thing that we're talking about today is just keeping your immune system strong. Sleep is so critical during this time. We did some webinars on sleep, of course, on nutrition and physical activity, but all the things to keep your immune system strong during these times. Again, if you have the comorbidities or the, have a chronic condition, it's even more important. And the getting creative. I mean, people have been so creative during this time. I just love all the things that are going on. So if you continue to learn one new thing, if you have kids, you're learning every minute about remote teaching. So that's really important. And then just staying flexible with yourself and others. Some people, just your fellow workers at this time. And Ed, you said you like seeing the kids. I do too, and the dogs. That's a good thing right now for being flexible during remote.
Yeah,
My son, go ahead.
to that point, and being creative, and I'd be interested if anybody has anything that they've seen that was really created. I know we've seen a lot of team meetings for fun events. Like I saw like a bingo style type of remote session, or just something that was non-work related, getting a team together, doing a Zoom meeting where you did something fun or some kind of game, or everybody did a meditation, a group meditation, or did something, like an exercise session or something like that, where everybody did something together, or just told funny stories. But has anybody else had anything that they've seen that that was creative and fun?
Yeah, we did a paint night. So like 30 of us got together and we hired somebody who does that for a living, and we painted a picture, and it came out really well.
Nice.
And I realized not to quit my day job to be a painter.
Was that virtual? A virtual?
Yes, that was virtual.
Nice. Wow. I love that.
Yeah, 30 people on a Zoom call.
We did some, not me, but one of the departments at Northwell did a dance party. That was the most fun thing. They had a DJ. It was an employee. He was an EMT. He was on the back of his ambulance, and he was spinning the music, and people were like dancing. It was so much fun. So things like that,
Nick Ortiz just put in the chat that they've done Kahoot, a trivia session within as a great activity.
Oh, that's a great idea.
Yeah.
It's a great idea. And, one thing we've experienced is, in integrating things into longer meetings as well. So like you mentioned, Ed, exercise, simple things you can do to stretch right at your desk. Guided meditation we've added into meetings. So some of those longer meetings that people know they're going to be on the line, a lot of our leaders have really embraced incorporating these things into their longer meetings as well.
I have an example of a fail.
Oh, good.
I wish everything was good all the time. And Pat, I did try to go on the chat and ask you if you could back up a page back to that social, but maybe we could do that afterwards. But we have a small group that's working remotely. We're a pretty small company. We're approaching about 20 people, and we probably have 6 to 7 people right now off site. And we put in an end of day meeting primarily as a mental health checkup, and also to check in and make sure business was getting done, going back to the dark days of March and April. And we've continued to do those. So we were talking to them the other day about what could we do to make the meetings better, because to me they're getting on the stale side and they're not really doing a lot. So a couple of suggestions came out, shortening them. We add in a training session one day where each person gets to feature on a specific thing that they need to get done and explain it to the group. But while we were having a general discussion around it, one of the employees brought up that we had said, one of the couple of principals here, one of my partners had said going back a few months ago, we did a happy hour one afternoon.
Oh.
And a comment was made that we look to do that every 2 weeks. And she pointed out to us that we failed on that. And people, these people who are remote, I think the feeling was that, yeah, they'd like to see the other people in the practice. And we kind of fell down on that. So I'm going to get that back in place pronto. But I
Mhm.
think it's as important when you pick out the things that you're going to do that you follow through and be consistent on them.
Mhm.
Otherwise, you're just setting yourself up for disappointment with people and failure. So
Abs-
we failed, but we'll fix
Oh, see, well, you're a vulnerable leader. I love that. So you're mentioning
it. I've had lots of emo training, so no problem.
that's healthy. I love it. Oh, that's great. No, I mean, anything, yeah, this is tough days. So anything you can do, that's fantastic.
Hey, Pat, I'm
Yep.
I'm Tommy DeMisa. By the way, I was texting with my mom. My mom says hi. My mom's Debbie DeMisa.
Oh, very good. Oh my
yeah.
God. Say hi.
I will definitely. So I go to this it's like an online. I find times it's difficult to explain it. It's called Remote Daily, where we get together and there's a talk show and they interview a thought leader, and it goes on from 1 o'clock to 2 o'clock every Wednesday through Friday. Well,
Wow.
we start the meeting with like some breath work, and somebody leads us through a guided meditation, only for about like 4 minutes.
Mhm.
But I look forward to it. It's in the middle of my day, and if some doesn't vibe with everybody, not everybody's sort of on that frequency, but like in that room they certainly are. But it's game changing. Like you literally, you can bring yourself like back down, and it falls like right in the middle of my day, so I love it. But even like to Robert's point there, like depending on the interest level of your employees, if they're going to dig that or not, I think any sort of intentionalness around like the breath and just some meditation type stuff, it's literally brings you back down. And that's a nice way to start something when you're coming from chaos.
Oh, yeah.
And you want to, it lets you arrive somewhere and have that space together versus just like one Zoom meeting, quick grab another coffee and get into the next Zoom meeting. It kind of gets you set up and gives you space. So I think that's important.
Oh, that's fantastic. I mean, again, ask interest survey, ask the people, but there's sometimes a case like that, Tommy, where maybe somebody didn't know they liked doing that, and you do it once and they say, oh, this is fantastic. So it's a balance that way, but people love that. I think that's great. We try to do that. But your mom, she has all righty, very good.
You froze up, but I got the message. I got it.
Okay. Next slide. So just a little bit then about what Northwell did. We can move pretty quickly through this one. Dina, next one. I'll just
Sure. Keep going.
Again, this is our, we came up with our mission and vision. This happens to be ours. You'll see it down at the bottom. You have our attributes, the trust thing again that I always talk about, access, that type of thing, individual accountability. You as an employer, you can just do so much. You put it out there, you create a healthy culture, then the employees do have to actually do it, to take part. So next slide.
Oops, sorry.
Yeah, one back. Yeah, just to show you again, it's not a bunch of programs. This is the culture that we're trying to create. We have chaplains. We do have a platform where employees have on their app, My Wellness. You'll see that. Breastfeeding support. So you might not have this issue, but we have rooms for employees. We have 75% women at Northwell, so that's really important. We have night employees, so we do a lot for them. I have one person on my team that does just help support the night employees. My Healthy Body is just what we were just talking about, some exercises for employees. We have Weight Watchers, so lots of different things that go on to have this overall holistic approach. Next slide. So that's pre-COVID. This was all pre-COVID. Now the next slide this is now. What we did do, which was like my team's dream, we have it all in one place now, and it's called, so it's a one-stop shopping. It's all in one place together well. And you'll see the topics on the left: emotional support, stress management, Substance use prevention became very critical during this time. In fact, I have a big meeting later today on, the statistics are up in terms of alcohol use or misuse, things like that. So we're still have a focus there. The spiritual focus through our chaplains, healthy eating, the financial, again, became extremely important. Physician resources. We have over 7,000 employed physicians, and it's sometimes a challenge to involve them. But again, that's one of the things I've seen during this time is that they are becoming more vulnerable and participating in things. So that's been important. And you'll see the list. There's so many things that we do. The team, my team, and Lauren and Dina are on there. We put out an emotional support call center where we triage employees into all the different services for their emotional well-being. It's important. That's a really critical thing, because for you as an employer to be able to tell the difference between somebody that might need a emotional wellness stress program, breathing, things like that, all the way to somebody who really truly does need behavioral health support, a psychiatrist, a therapist. So it's a very broad spectrum of emotional support needs. And my team has gotten so good at being able to help employees with that. You'll see we do these tranquility tents where at our different hospitals, employees can come out and have a space where they can have some water, maybe talk to a counselor about setting up a session, all the different resources. Nutrition became so important during this time. I mentioned before, and we put out somebody from our team, a registered dietitian. She created a series of videos. We should have shown one today, Dina, maybe, but 2 to 3 minutes of healthy recipes. Those have over 5,000 views. Lauren runs our YouTube channel. Employees are looking at those things. It's really exciting to see. Okay, next slide. So here's the thing I was saying before. We tried to listen to what the employees said they wanted. You can go to the next slide, Dina. We did 2 separate surveys during COVID. One was for all team members, and that was a general survey about things that we were asking them what they felt they needed support on. And you can see we had a 35% response rate, which is pretty high for any type of survey. And then we also did a remote worker survey. So I think you'll see that what we learned from these can be applied to what you're doing. The next slide. And these were only out for a week. So no surprise, managing stress, caring for my overall well-being, and caring for my physical well-being were the top 3 needs. And again, so many people responded that I think you can apply that to your own group. Stress is number 1 on here. And then you'll see the 4th is financial, and then the caretaking responsibilities. And that one was even done before people kind of knew I'm going to have my kids home full time. I might be trying to care for an elderly parent or somebody that's sick. So this slide, I think you can apply to whatever you're trying to do.
Hey, Pat,
yeah.
do you have any tips regarding surveys? Surveys are only as impactful as the response rate, right? And it seems like at Northwell, you guys have done a good job at getting a very high response rate, especially with the remote employees. Of 65% is pretty high. Any tips around that, or what employers should be considering in their surveys to get more employees engaged?
I think the key was keeping it short. I think there were like 5 questions on the one for all employees, and they could opt to answer if you had kids, and there was a separate option for caregivers or care, even for childcare. It was for childcare. So keeping it short, we promote communication. We promoted it like crazy. It was only on for 1 week. That was the other thing. 1 week, just get your thoughts known so that we can help you.
I think also to add to that,
Yeah, she's good.
Sorry, Pat, I was going to add to that by saying the other critical piece, I think we do have a very engaged workforce, but I think one of the reasons that our surveys do get such a tremendous response is because we continually feed back to people once the survey is complete. And so in many of our communications, we are really listening. We are taking actions against what has been shared with us from their perspective as most important. And we're saying, we heard you. And as a result, we're putting in place this program or that program. So it's showing that, yes, we get your feedback, but it doesn't go into Neverland. We actually turn their responses into action.
Yeah, Tommy said that your point is right on. That's so true. Dina also plays a dual role of also understanding communications and marketing. So yes, it's so critical. So next slide.
Ed, are you having trouble hearing Pat?
I think Pat froze, or she's got a new dance move.
Yeah. Hey, Pat, just so you know, we lost your signal for a moment, Pat. She might be able to hear us, but not, it may not be coming through on her side. We'll give her a minute to
Yeah,
to
you know,
regroup.
well, I'll throw another question out there to you if you don't mind,
Sure.
while we're waiting for her. You know, are you seeing that employees, I mean, wellness, culture, everything we're talking about is more prevalent than ever before. But I think employers understanding the impact on certain things when it comes to recruiting and retention is very, very valuable to understand that, because I think in the past when they're measuring ROI, that kind of got left off. So my question would be, are you seeing more employees as they're as you're recruiting and applicants that are actually looking for this in employers as they're selecting their employers?
Yeah, that's a great question, Ed. I think that our talent acquisition teams would say absolutely, because what we know from national trends is that workforce individuals are looking for companies that align with their personal values, whether it's social responsibility, whether it's looking out for their own well-being, whether it's opportunities to participate in events as groups. So there's a tremendous amount of shift, I think, even in the language of HR that's happened over the last couple of years, certainly as the economy has been strong and it was harder to find good, let's say good candidates or find that, top tier talent, that I think organizationally, just in general, that the language has shifted around what's important to an employer to retain and attract and retain top talent, but also in terms of just talking about the word engagement. Even if you think back 5 or 6 years, wasn't even as big of a part of the vernacular of HR as it is today. And the culture has certainly become front and center. So yes, I do think that certainly our talent team, recruiting on a regular basis is using this language, using strategies to attract top talent by talking, and we get featured often side by side with other aspects of engagement that we do in the organization, whether it's diversity, inclusion, things like that. We get featured all the time as ways to attract candidates through LinkedIn, for example. So yes, I definitely think there's been a shift and people paying attention more on both sides, from both the employer and the candidate's perspective.
Yeah, I think that's a great point. And I think, the way I look at it is, in the past, when people looked at wellness, you thought of health, you thought of, what's your diabetes, you thought of heart disease, you thought of things like that. But now that's extending to, stress management and things on this list. If we look at this list, things that a lot of people wouldn't even think that would be involved in wellness, right? Like casual attire to work, reduced time spent on commuting, things like that. That's all part of wellness. If candidates are looking for this, because if they have less time in traffic, they're going to be more productive, right?
Absolutely.
If they can, if they can get out the door in the morning, in jeans and a button-down shirt, rather than having to wear a suit every day to work, that might be, that might promote more relaxation, which, in our opinion, promotes healthier in the workplace, more productive employees. I think people are looking at that, to your point.
Absolutely. Pat?
Hi, Ed. I appreciate that comment. It's Lauren Delinsky. I just wanted to comment on that too, because just from personal experience, and I think Dina can attest to it as well, just dress attire alone can make a big difference. Commute can make a big difference. Dina was commuting probably upwards to an hour to work, and myself about 40 minutes. And I only live about 6 miles from the office. So for you to be commuting on Long Island, it's sometimes crazy, but it does relieve a lot of stress in your life to remove those barriers. And it helps with, creating a more family unit as well. All these benefits of remote work. So I think that's something that, we do have to look at and consider moving forward.
Yeah, I agree.
Hey,
I'm back.
Ed.
Sorry about that.
Oh, good. There you are, Pat. I was just going to say, well, I was going to put you
No,
on, call you on your phone. Okay.
No, you guys are the experts. No, my team, they know better than me. Believe me, you guys, you got the best. So, I don't know what happened. It just lost. It went out.
That's okay. It happens, Pat. So we were just chatting about, if in fact, when we're recruiting people, we see that individuals are actually looking for the kinds of programs that, that we offer in particular, or in general, are they looking to be aligned with companies that are offering programs like ours? So, so we talked a bit about that, and the answer is yes. And so I think we covered pretty well on this particular slide. If you want to move forward to the next.
Oh yeah, absolutely.
Thanks, Pat.
We're almost at the end. I think
Yeah.
Yeah, again, we've mentioned some of these things. The social aspect was important. The technology challenge, see, right there. That happened today to me. So next slide, because I'd love to have questions or keep going. Yeah, again, we've mentioned a lot of these things, the listening, the tents you can see, and the well-being pictures. The call center, that blue one there, that's the thing that my team, we man that, and we still do, the 24/7 Emotional Support Resource Center. And if you've driven past 2000 Marcus in New Hyde Park, you might have seen this beautiful structure that's up there. That is very, very beautiful. And people did actually receive some bonus and PTO time for their efforts. And it was not just for the frontline workers, it was for the people supporting them too. So that was very important to us. And the last one, next one, Dina. And not to end on a sadder note, but it was actually very, very beautiful. We did, with a population of 70,000 employees, sadly we did lose employees, and we held a beautiful memorial service for them and for their families, and gave them financial support, and the chaplains were there, and Michael Dowling, and it was a very, very beautiful way to honor them. Because again, and this is well-being, our team and the chaplains and everyone in our partnership really wanted to support the employees that were left behind from some of these departments that lost employees. So it was very, very beautiful way to honor them. So that's it on the slides. Thank you for your patience with me. Let's open it up. Anybody has questions, or I'd love to hear what they're doing. We learned from you guys.
Yeah, questions, comments, anybody?
I have a question. Oh, really nicely done. Thank you for the information. My question is, and maybe you covered some of this and I missed it, but in an organization of your size, are you giving these as benefits? Is there any sort of, I'll use the word copay because that's our business, but is there any out-of-pocket cost for the associate, the employee, or these, like, I'm just jealous that tent is there and somebody can go meditate, and I'm like, I got to figure out where that is because I want to go there. But like from the smaller groups, less resources, maybe you could speak to, are you giving this away, or is it, how that all works?
Yeah, we did say that no charge. We're separate from the benefits. I mean, we actually report to the head of benefits to awards, but we operate because the union employees, of which there's 22,000, they have different benefits. So we try to keep ourselves as we're Switzerland. we try to stay, very neutral and provide as many free resources as we can. And that's what I do want to send to Ed. There are so many free resources out there too, to provide. And, there are some that you do have to pay for too, but there's enough good resources out there.
And if I can go one step further with that, and maybe that's where you're going, from a community perspective, and my cousin Vincent is in community relations with the health system, so I know some stuff. But
I know Vincent.
I figured you did, yeah. So in that case, like, is there resources, and maybe that's what you meant, for the community? Like, if I'm a small business owner in the community, like, maybe there's not enough, maybe we don't know enough about what's available for my employees to plug into the health system like that.
Mm-hmm. Dina, you wanted to take that one?
Sure. So, yeah, I mean, over the years, we've had a very robust relationship with the community through Northwell, and it's very well streamlined through our community relations department. I think, having worked in hospitals and healthcare settings for years, one of the things that I always said in marketing and public relations is most people probably don't realize exactly what is available from a large hospital, for example, one hospital, because everyone thinks of it as a place to go when they're sick, right? But the truth is, if you think about a place like Cohen's Children's Medical Center, or a place like Southside Hospital, or North Shore University Hospital, if you think of any of those hubs and others on Long Island that are not part of Northwell, one of their, reasons of being really is to provide community health services. So any number of times of a day, you can find a wellness workshop, a smoking cessation program, breastfeeding support, really any number of programs. They sponsor walks in the town. Things like that are constantly happening. I know we have a huge workshop series on orthopedics. We've got a huge amount of women's health resources that are at no cost to the community. So I think that as an employer, even if you have a small organization, and if engaging with your employees is important to you, I think you can become a hub of sort of harnessing all of that information from around your immediate area to share with your teams and say, hey, did you see there's a 5K this week, in a couple of weeks over, at the Great South Bay? Why don't we go? So there's plenty of opportunities to engage, even in a smaller work environment. And then, for instance, there are medium-sized groups that Pat and I are working on wellness assessments with. So some of that listening, right, helping them go through the process of organizing their strategy. Perhaps they just aren't sure where to start. Maybe they've started and stopped. Maybe they've dabbled in programs, but they want to really be more strategic. And through our Northwell Direct, which is a direct to employer service that we offer, we can help organizations that are looking to get focused, start with a wellness assessment and actually help them think about how to organize. So I think it just depends on the organization, but it really does often start at the top. Whether you are the business owner or you are the head of your HR department in a mid-sized group, 100 and 200 people, you've got to sort of say, okay, this is a priority. This is important to our people. How do we keep them healthy and help them stay engaged and motivated at work? And then start to say, okay, we could do this on our own, and this is how, and you create a roadmap, just like you would with any project. Or if you're smaller and you just don't have those resources, really take a look around at what's available to you right in your own backyard. Most of us are nearby a major medical center, whether it's Huntington Hospital or Syosset, Plainview, wherever you are, there are going to be tremendous resources at those places where you can make your own employees aware, or you take it indoors, sort of in-house and bring it all together. We've helped companies do that through wellness assessments.
Thank you.
Sure.
This is Danielle. One other thing that I would add to, just on the insurance side, would be take advantage of some of the programs and the offerings that are through the insurance carrier. There may be a health risk assessment that's online that folks could take, and some other wellness programs. I know they had some gym reimbursements and things of that nature. So again, there may be some free offerings that are already built into the insurance plans that many of the groups should take a look at as well.
Yeah, that's a great point, Danielle. And to that point, like United Healthcare just announced they've changed their wellness offering, and they're actually including weight loss programs, smoking cessation programs in their groups, even to smaller groups. So I think that the buy-in is definitely there from the insurance carrier industry as well. It's a good point. Any other questions? Okay, I'll just make one comment that out of listening to some of the things that I wrote down that I think that we got out of this is, even for a small employer, there's plenty of opportunity that won't cost a dime to get you started in wellness and to helping the employees become more healthy from a lot of different perspectives. That was my takeaway, whether it be surveys or just listening. As Pat said before, if you do listen, I thought that was a great point, that if you're sending out surveys and you're not doing anything about what your employees are responding, then you're really not going to get much buy-in to the future surveys. So I think that was a great point. And I think meditation and casual dresses and remote schedules and being flexible with your employees, even especially now, right? I mean, with COVID, I think that everybody had to change the way they did business or work with their employees to some degree. And I think that the stress is definitely there on a daily basis outside of COVID, but that was expanded when employees now had to come back to work and not only have the normal stresses of every day, but have the stress of, am I going to get sick? So I think flexibility is a key word there that I took out of this whole thing. So I think this was great. Any final comments? Pat, Dina, Danielle, Lauren, anybody want to make any comments before we wrap up? I mean, we did an hour and this really flew by, right? Pat and I were talking about this, Dina, we're talking about this, that, we'll do, maybe 20, 30 minutes and then we'll open it up some questions, and that flew by pretty quickly. So this was great.
Yeah, just thank you and take care of yourself during this time. That's my final comment.
Thank you.
Great tip.
Bye-bye. Thank you so much.
Thank you so much.
Thanks, everybody.
I want to thank the team from Northwell one more time. Looking forward to seeing everybody on the 28th for our employer education event entitled Self-Funding 101. So thank you to all again. Have a great day.
Thanks. You too.
Thank you.
Thank you.
Great day, everyone.